So been a few minutes since I said anything about COVID. So I've got to throw this in here because this was stunning to come out 3 months ago, that the microbiome is determining the amount of COVID illness. And hopefully I see that there are some people raising their hand and people are making comments. Maybe someone can throw in a comment if you know a vegan, a healthy diet vegan who actually died of COVID. So I know a massive number of vegans, and what they share is that if they got COVID, they weren't very sick very long. When that became clear a few months into it, people were bragging about being vegan and not getting COVID. And you know what? That's not going to be true. Not likely to be true. You get COVID, you just don't get sick. That can make you an asymptomatic carrier. So I was telling everybody who was vegan to please wear your mask because you don't know who you're going to infect. And then they're going to infect somebody who's not vegan, who's going to have a bad outcome. So that observation was very clear very early on that the people on plant-based nutrition were doing better. I don't actually know of a vegan who was actually hospitalized. I'm sure that's someone, but the hazard ratio must be incredibly small. And it's hard to collect that kind of data. But going along with that explanation, including the people who got the second vaccine, the vegan half of my family, we got the second vaccines, no problem. The non-vegan half, they all got sick. They got a fever. They got, passing out. All kinds of stuff happened with the second vaccine because you're getting an inflammatory reaction because the thing is actually working. And it turns out that all of this is controlled by your gut microbiome. So do we have the guts to go vegan, and why would we do it? It's because of this that was published very few weeks ago, that the gut microbiota actually reflects the severity of the immune response that you're going to get with COVID-19, how much you're going to attack yourself with these cytokines and inflammatory markers. And all you need to do is get the kind of bacteria that is the microorganisms in the GI tract to behave biochemically. And the way to do that is to change them out. And so how do you change them out? Vegetarian and vegan diet. It turns out within 5 to 15 days, you could have a much safer microbiome with these Bacteroidetes species and those are much safer than the ones that are populating the bacteria of omnivores. So the vegetarian diet, I know that people are very disappointed when they saw that their probiotic studies showed no benefit, but the vegan diet changing your gut microbiome will have some improvement in outcomes. Now I'm throwing in a little bit of a twist here. It seems like a tangent to talk about kidney disease when I'm a cardiologist, but we did start a cardiorenal clinic because of the, people, once they're dialyzed, they don't die of kidney disease. Kidney disease patients die of cardiac disease. It accelerates the plaque formation, puts the afterload on the heart. If you have a shunt for dialysis, it's a high output state on the heart. And so what we really need is the best blood vessels that we can get for our kidney disease patients. Well, guess what? How do you ruin kidneys? You give people animal protein. And it turns out that animal protein is toxic to the kidneys themselves. And there's an inverse relationship between plant protein intake and the risk of developing chronic kidney disease. So anyone who somebody tells you, oh, I've got CKD stage 2 or stage 3, immediately should go on a plant-based diet because the red meat particularly, but animal protein in general, increases the risk of end-stage renal disease. That relationship is very strong, and it's something that is easily improved. And so and even if you did just go to other non-red meat products, that would be better than continuing with red meat. So what's wrong with it? Well, again, it's TMAO. And so and the gut microbiota. And so I hope everyone is hearing that message and you will change your GI tract by doing much more in the way of plants. Save the kidney, save the brain, save the heart. Okay, all right. One last thing about TMAO and the microbiome that people should know. This is the interesting experiment where you give a vegan a steak and you give an omnivore a steak, and then you measure TMAO several times in the first few hours and then again at 24 hours. And the vegan doesn't get TMAO. Why? Because the microbiome is a vegan microbiome. Now, if you feed them, animal carcasses, or however you want to say that, every day for a couple of weeks, they're going to have the bad microbiome as well. And so it's very protective to have the plant-based diet. So that goes a long way. So that's one component. I know I focused on that quite a bit, that Alicia Wilk has talked about: diabetes, stroke, heart failure, coronary heart disease, and had multiple mechanisms for all kinds of bad outcomes. But she also included the TMAO, which you see on the left, sort of in the middle is that heme iron business. And it's become famous because one of the plant-based meats included heme iron. Not sure that's a great idea, since the NIH-AARP study says that heme iron is one of the things that increases mortality, that if we're doing heme iron, we are going to produce reactive oxygen species that hurt the blood vessels. We should be getting our iron from plants, not animals. And the foam cells are really seriously, these are the ones that create all the havoc inside of a plaque. And when they are upset, they're going to rupture that plaque, and that instability leads to the clotting off of a plaque, which leads to a heart attack or a stroke.